Maayong adlaw na itong tanan. Did you have a knee replacement? In today's video, we are going to do 5 exercises 0 to 2 weeks after you had your knee replacement. Hi, I'm Nathan. I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. Now, if you had your knee replacement, it is very important to start with your stretching and your strengthening exercises. You do not want to have that tightness on your knee. Otherwise, that will lead to a bad walking pattern. And it is also advisable that you wear loose-fitting clothes or short pants so that it will not irritate your knee or the surgical site. If you are ready, let's start. For the purposes of this video, my knee that had the knee replacement will be the right side, the one with the tape, okay? And we're going to do exercises that is the easiest first, going to the most difficult one. And by the way, just a fair warning, it might be painful. So be gentle, and if you need to take your pain pills or ice your knee, ice it first, okay? So the first one is ankle pumping. So it will be toes up and then heels up. Toes up, heels up. All right? Let's do 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that's ankle pumping. Next exercise is the quad setting. So you want the leg that had the knee replacement as straight as possible, but initially you cannot do that. It will be very painful. And if you force it to straighten out, that might irritate the surgical site. So just go as straight as possible and as much as you can tolerate, okay? Don't force it yet. And then try to bring that knee down towards the floor by contracting or squeezing your thigh muscle, the front thigh muscles or your quadriceps muscles, okay? So you're going to do that, okay? If you can see it, I'm just bringing my knee down, trying to straighten that leg as straight as possible and contracting or squeezing my thigh muscle. Let's do 10 of those, okay? And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that is quad setting. Okay, so the next exercise is the straight leg raising, just like this. So we want our leg with a knee replacement straight again, as straight as possible. Don't force it, but as straight as possible, okay? You're going to just kick it up, keeping it as straight as possible, like this. Straight leg raising. Let's do 10 of those. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And that is straight leg raising. Next exercise is the front kicks. So what you want to do is to pick up that leg, keep it bent first, and then you're going to kick slowly, just like that, okay? So kick, bring it back, and then kick. All right, let's do 10. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Slowly bring it down, and that is front kicks. Fifth exercise is to improve your range of motion of that knee. You want to be able to straighten it out and bend it as far as you can, right? All you need is a paper plate, all right? So you just put the paper plate on the floor. If you have a carpeted floor, this will slide easy. If you have a wood finished floor or a laminate, this will also slide easy. This is why I am not wearing socks, all right? Because if I wear socks, it will only slide on that paper plate. So it is easier when you are barefooted. Okay, so you want to put that leg on top of that paper plate like that, and you're just going to slide it forward and then bring it back as far as you can. Okay, slide it forward as straight as possible and bring it back as far as you can. Okay, let's do 10 first. Okay, and 1, slowly come back. 2, 3, 4, 5, 6, 7, 8, 9, 10. Now bring it back. This might be the most painful position, a bent knee, but we want it to bend as far as it can so that we are able to regain that range of motion. So towards the end, you want to pull that knee as far as you can with your good leg, or if you can reach down, just pull it back as far as you can and hold it for maybe 10 to 30 seconds. All right, so that will be your range of motion exercise for the first 2 weeks after you had your knee replacement. So there you have it. Those are your strengthening and your stretching exercises 0 to 2 weeks after you had your knee replacement. If you have any concerns, questions, or suggestions, please type them down below and I'll be happy to answer them. And don't forget, let's exercise our minds and our bodies so we get stronger together. Until next time, paalam!